previously, explain the process of examination and seek consent. Additionally, review the chart of the mother and the newborn to understand labor complications, if any, and the newborn's health status. The newborn should be assessed in a quiet, warm room with good lighting and in the presence of the mother at a time that is convenient for the mother and the infant. The infant should be well fed and alert before the exam. The examination should be thorough and systematic and assess the infant's status and body, starting with the head and moving toward the toes. 1. The infant should be naked during the examination to be able to assess them completely for any abnormalities. However, it is also important not to keep the infant uncovered for a long time. The equipment necessary for complete newborn examination, including stethoscope, swabs, pen torch, tongue depressor, measuring tape, infant scales, and disposable gloves, should be arranged and sterilized before the examination. Before assessing the newborn, it is important to practice safe hand hygiene measures to reduce the risk of cross-transmission. The first step in a complete newborn examination is to assess the appearance of the infant, including skin, activity, and posture. Assess how the newborn responds to touch, light, and sound. Most often, a healthy newborn reacts to touch, light, and sound, moves its arms and legs equally, is able to suck, and passes urine and stools within 24 hours of birth. Generally, a newborn passes their first urine within 24 hours from birth. Later on, they may continue to pass urine 6 or more times a day. The first stool of meconium is passed within 24 hours from birth. Subsequently, the infant may pass 6 to 8 stools per day. The first stool of meconium is dark and sticky and may become yellow and soft with a particular smell later on. A normal newborn has increased muscle tone in the upper and lower extremities. The neck and the body are hypotonic. 1. In the resting position, a normal newborn has their hip abducted and partially flexed with knees flexed, arms adducted and flexed at the elbow, fists clenched. If the infant shows any danger signs, such as not feeding well, history of convulsions, fast breathing, severe indrawing of chest, fever, low body temperature, and presence of jaundice, the infant should be referred for further evaluation. The infant's skin should be assessed for color, texture, and elasticity. Skin color may vary based on ethnicity. Yellowish discoloration of the skin may indicate jaundice. The presence of jaundice can be assessed by pressing the infant's skin with the index finger and noting the color of the skin when the finger is lifted. This should be done under natural light. It is important to note that jaundice in the first day of life is not a physiological sign and requires immediate attention. Loss of skin turgor can be a late sign of dehydration. The presence of cyanosis, pallor, pustules, bruises, and abrasions on the skin should be noted and recorded. It is also important to inspect the skin when each body part is examined. It is also important to note that some skin conditions, such as milia, or white spots around the nose, and erythema toxicum, or red spots with tiny white centers appearing on the face, trunk, and back, are common among newborns and do not need any treatment. It is also normal for newborn skin on the trunk, abdomen, and back to peel after a few days. The infant's head is assessed for shape, size, and symmetry. Open soft spots between the bones of the newborn's skull, called fontanelles, and birth trauma. A tense or bulging fontanelle may indicate